Hi everyone. My topic for today is epilepsy and diet. Epilepsy is a neurological condition resulting from abnormal brain activity with a worldwide prevalence of 0.5 to 1% and a lifetime incidence of 1 to 3%. It is also known as a seizure disorder, and an estimated 30% of epileptic patients continue to experience seizures throughout life despite adequate drug therapy or surgery. The treatment and complications differ for different individuals, and it can occur at any stage of life, but it is mostly prevalent amongst children. Now, understanding the background. Um, so, the presentation covers understanding the non pharmacological approach towards the treatment. In recent decades, dietary regimens have been used effectively in the treatment of drug resistant epilepsy, following the path of a non pharmacological approach. Understanding how different diet work on epilepsy, understanding the ketogenic diet and its variants like the modified Atkins diets have an established role in contrasting epileptogenesis through the production of events induced by physiological ketosis. Understanding the pathophysiology of epilepsy and ketogenic diet. Now, the classic ketogenic diet is a valid therapeutic choice for the last 20 years, especially in children with epilepsy. There are newer versions like modified Atkins diet, the low glycemic index diet, and the medium chain triglyceride diet that have come into play recently. Now, understanding what is ketogenic diet. Ketogenic diet is a high fat, around 80 to 90%, low protein, 6 to 8%, and carbohydrates 2 to 4%. Now, the ratio of fat per protein is 4:1, that is 4%, 4 portions of fatty acid and 1 of carbohydrate and protein. Now, for children of growing age, it is usually around 3.5:1 or 3:1. This can be achieved by two methods. So, in the first method, the fasting patient is hospitalized for 12 to 48 hours, or when ketones are present in the urine to monitor the state of hydration. Now, once ketosis is achieved, meals are calculated to maintain a constant KD ratio. In the second method, hospitalization is not required and the KD ratio is gradually increased weekly from 1:1 to 4:1. However, there is no significant difference between the two diet approaches, and the time required to achieve ketosis is same. So it is always preferable to use the second method where fasting is not required. Now, there is also a reduced intake of fruits, vegetables, milk, and derivatives. So, multivitamin complexes and mineral supplementation are a must. Now, when we talk about how ketogenic diet works, so ketone bodies like beta hydroxybutyrate and acetyl-CoA serve as a source of energy to the brain cells in absence of sugar. Now, the metabolic shift seems to disrupt the abnormal changes in the brain. So, you are basically forcing the brain to use a different fuel. Now, we don't know how exactly it works, but it is almost as though the brain cannot figure out how to produce seizures using this new energy pathway. Initial cohort and randomized control trials have been run and have shown to reduce the seizure frequency. More than 50% reduction in seizures observed after increasing the ratio, like from 2:1 to 3:1 to 4:1. Now, both short-term and long-term efficacy was reported in the meta-analysis, where 50% of children reported 50% reduction in seizures. Coming to modified Atkins diet, so it is used since 2003 to treat refractory epilepsy at Johns Hopkins Hospital. It has high fat content around 65%, low protein again 25%, and carbohydrate around 10%. The fat per protein and carbohydrate ratio is 1:1, and it is more palatable, of course, and less restrictive diet, suitable for children with behavioral difficulties. And the food portions are estimated, so there is no need to weigh food, like unlike the classic ketogenic diet. There is also no limitation on liquid calories, though the restriction is definitely on the carbohydrate intake, that is around 10 to 20 gram per day in children and 15 to 20 gram per day in adults. Now, when we look at the efficacy of modified Atkins diet, 30% of subjects reported more than 50% reduction in seizures in the study period. Subjects were prescribed 4:1 diet, while those on modified Atkins diet were allowed 10 grams of carbohydrate per day and an increase of 5 grams per day up to 10% of the total weight. Now, the 3-month assessment showed baseline seizure frequency in ketogenic diet to be around 38.6%, and for modified Atkins diet, it was 44.6%. At 6 months, KD was 33.8, and modified Atkins diet was around 44.6%. Now, differences between the two were not such statistically significant.
Glycemic index treatment. Glycemic index treatment term is used for food on their tendency to evaluate blood glucose levels, used for refractory epilepsy in 2005 at Massachusetts General Hospital, Boston. Less restrictive diet, high fat, which is 60%, protein allowance greater than other diet, which is 20 to 30%. A low carbohydrate content with the foods low in glycemic index, that is less than 50. The fat per protein and carbohydrate ratio is 1 and 2.6. Produces fewer ketone bodies as compared to KD, but more palatable. So efficiency of LGIT is lesser data available on efficiency of the diet. Efficiency was reported in cohort 22 pediatric patients educated about intake of low glycemic intake food. Seizure frequency at week 2, 3, and 8 after treatment were lower with baseline seizure reduction rate of 56%, 61%, and 67% respectively. Medium chain triglyceride diet introduced in 2008, high fat content, which is 30 to 60%, low protein, which is 10, and carbohydrate percentage is 15 to 19%. MCT produces more ketone bodies than LCT, hence reducing intake of fatty acids and allowing more consumption of protein and carbohydrates, helping in the growth of children. Efficacy of MCTD. A randomized study conducted by Squarch et al. Compared to KD with both traditional MCTD and the modified MCTD diet in 55 children and 3 adults, and the seizures were effectively controlled in less than 15. Multiple studies have shown positive result in controlling the seizure, but there are limited evidences claiming that the KD is better than other two types. So the conclusion is ketogenic diets were able to lessen the seizure episode with the children and adolescents with refractive epilepsy. All the four types of ketogenic diet irrespectively have more or less similar impact in patients aged 2 to 18. Is also much evidence available for efficiency of KD in adults. Effect of strict KDD diet on health outcomes is not clearly known. However, impact of this diet on growth and cardiac function remain utmost concern. So here are some references to this topic, and